All right, we're streaming live now on YouTube. Let me know when it's ready.
Okay. You're good, John.
Good. All right, we'll begin the call to order the Ozaki, Washington Ozaki County Health Department. Affidavit of posting. This agenda was posted in the Office of County Clerk on the 11th day of September 2020. Notes were sent to the West Bend Daily News, WIBD, WNBZ Radio, WTKM Radio, Express News, My Community Now, Hartford Times Press, Key Western Statesman, and the Milwaukee Journal Sentinel. We have a quorum. We can move on. First order of business would be the minutes of July 17th, 2020. I'll entertain a motion to accept.
I'll motion.
Chris, and was that Kathy?
Yeah.
Okay. Any changes, any discussion on the minutes? Hearing none, all in favor, signify by saying aye. Aye.
Aye.
Aye.
Any opposed? Okay, number 3 is a communicable disease update. That'd be Kirsten.
So it's included in your packet, our total numbers. As you can see, for 2020, we have an increase in some STIs. I think we talked about it at our last session, our last meeting. This is not necessarily surprising to us. We've seen this uptick occurring. Unfortunately, we've not been able to put as much effort into our work around STIs this year because of COVID, but it's still certainly in the forefront of the work we want to get to when we finally have a vaccine and can move on from responding to coronavirus. So, Kathy, I don't know if you want to weigh in.
I'm very curious, and it'll be something that we'll definitely have to look into after Corona's, but that gonorrhea rate in West Bend. I don't know. I don't have enough data to make any kind of statement on it. I just think it's surprising because it is quite a jump.
Right.
I'm sorry, not in West Bend.
It's in Washington County.
Yes. So I think it'll be something when our sexual health committee can convene that will be a big priority for trying to figure out what can be done about that, because that's really big. It's big.
Right.
Yeah.
I have a question. Are you done, Kathy?
Yes, I am.
Okay. You know how we have the COVID dashboard? Why don't we have that for the STIs in Washington and Ozaki County to let people know what's really going on?
We certainly could do that.
Yeah, I think it's on one of our goals. Because the committee is pretty new and we are in the process of, our mission and all that stuff. And we really were working on goals for our direction on where to move forward. And one of the goals is going to be communication and making sure that that information is available to people so they realize it.
But I mean, we could, Kirsten, couldn't you make a dashboard just real simple with those numbers on it, just to, like you do COVID numbers?
We could. I'd have to talk. The problem with the STI numbers is they're not as big as the COVID numbers, so we don't want anything to be identifiable.
Right.
So we couldn't necessarily put them in how we have the COVID numbers are delineated by zip code, for example. I don't think we could get that granular.
Washington County, Ozaki County.
Yeah, we certainly could. It's something we could talk to our GIS partners about.
At least then the public would be aware of what's going on.
Yeah, we certainly could do that.
And it could be illustrated in a very benign way, a circle with a needle on it. If you look at, more discussion needs, but whether we break down some of the different or the ones that we see most of STIs, just having a needle that is showing, is it low, is it middle, is it high? I don't know. It needs discussion, and I think it's a really good idea.
Yeah, I think so too.
But how to do it, I think we do have to be careful.
Kirsten, are the majority of the infections, I take it probably age 21 and under?
No, they're young adults primarily. I mean, that's the other piece. So this is the year that we were supposed to be doing the YRBS, the Youth Risk Behavioral Survey, which gives us a lot of good data around mental health and behaviors of young adults, so high school age students primarily. And that actually we got some really interesting data 3 years ago when we did it, I think. Out of Washington County, but because of COVID, it's been suspended and we won't be doing it until likely spring of 2022. It was going to be fall of 2021. That's what the state's planning on, but I have a hard time imagining that we're all going to be in a place where we can do something, do some sort of monitoring outside of coronavirus by next fall. I think it's probably going to get pushed to the spring. But that's part of this sort of data collection of having to have a better understanding of behaviors that are established as young adults, so in high school, and how they carry forward. But the majority are in like 20 to 30 range.
Okay.
Yeah.
All the people that feel they're invincible for everything.
Yes. The same people who now have COVID
Yeah.
and are not wearing masks.
Yeah.
Yeah.
Okay.
Yeah.
Okay, is there any other discussion on the communicable disease update? All right, hearing none, we'll go into the WIC report.
Sure. So in your packet, we have a third quarter WIC summary. As you can see, the waivers are set to expire in October. So currently we've been serving our WIC families virtually. We do a lot of Zoom calls with them, education over the phone. We do have families when they do need to see us in person, they'll come and we are all masked. They come to the downstairs of our building and we meet them outside to do it since the weather's been cooperating. But currently that waiver's going to expire on October 1st. We anticipate it will be extended, and my staff have been working diligently on sort of different pathways. What would it look like if it's not extended, and what will it look like if it is? Right now, the majority of our staff are working out of the Port Washington office. So that's sort of like our coronavirus hub. The intention, if they have to see people in person, is that we'll have a sort of just a WIC staff in West Bend, so we don't risk exposure to everyone who's doing the COVID work. So that's our plan moving forward, but currently it expires on October 1st. I also just want to highlight that our breastfeeding peer counselor got the Gold Premier Award, which is a national award from the USDA. Her name's Jamie Penza. She's phenomenal. And she is also has stepped up in the coronavirus response. She has our after hour phone every day and every weekend the entire time. We came up with that plan probably a month in. She offered, she has the phone anyway for her breastfeeding support. And she thought that she could help all of us out. So she's been, I mean, she's an amazing asset. We're really lucky to have her. So we wanted to highlight her. Yeah.
Kirsten, is there anything that we can do? And you said that your staff is really working on having it renewed. Is there anything we can do to help facilitate that process? I mean, and I'm sorry, I'm not familiar with it. Who decides whether it's renewed or not?
It's a federal decision.
Oh, okay.
Yeah,
And
the
so-
waiver to be virtual is a federal decision, and then the state needs to endorse it. But I think the state would endorse that decision. It's a federal program.
So this is happening all over the country?
All over the country. Mm-hmm.
Okay.
Yeah.
All right.
Yeah. And we've actually been able to find some great efficiencies working virtually. So we realized that there are opportunities where people don't necessarily have to come in. They can do it they can have their appointment virtually and over the phone, which is really helpful to a lot of our WIC families because they have young children. It's a hassle getting here, getting everyone in the building, there's strollers and babies. And so we hope to find some efficiencies long-term too.
Good.
Yeah. Yeah. And our,
I'm sorry, one more question. When will you find out whether it's extended?
so they had a meeting 2 days ago and there was still no news. Hopefully soon. We're approaching October 1st, but as with everything related to COVID, it seems to be very last minute. I would expect in the next week, if not September 30th. Yeah. Yeah. And then our WIC numbers have increased as we expected with the economic implications of people not working. Our WIC families, the numbers increased 7% over last year. I would imagine we'll see that go up as the fall moves forward too. So our WIC staff's been amazing.
is there something on the website, or is there any way that you can communicate to us as the board on whether it was renewed or not?
Sure, I can ask Missy to push something out.
Okay.
Okay, any further discussion on the WIC report? Okay, we'll move on to the COVID-19 update, Kirsten.
As we anticipated, we are seeing an increase in COVID-19 now that schools are back in session. We currently have 20 schools with investigations. That was as of this morning. I imagine there'll be more by the end of the day. We have 13 long-term care facility outbreaks right now between the two counties. One of them is rather concerning. They asked on Monday for testing from the state to test all of their staff and all their residents. By Tuesday afternoon, they still hadn't heard anything from DHS. So the health department stepped in. We provided swabs and connected with the Milwaukee Health Department lab and are currying swabs down to Milwaukee to make sure that they could test everyone. But they have a pretty high number of people who are coming back positive. So they're trying to work through separating the positives from the people who are not positive to slow down the spread. So it's been taking up a lot of our time this week in addition to schools. So it hasn't hit the press yet, but I would imagine that it will because it's fairly large. So just a heads up about that. In Ozaki, go ahead.
When you say 20 schools are under investigation, does that mean you have positive results in those 20 schools, or your possible positive results, or what does that mean?
So we went around and around because an outbreak is defined in a long-term care facility or in a nursing home as one positive resident or staff person. And then an outbreak in a business is two people who are connected in some way in that business setting. So we went around and around on how to define a school investigation because we felt like an outbreak made it sound scary. And what we realized on the first day of school is with one positive student, the implications are pretty broad around quarantine. So you could have up to 100 kids quarantined for one positive student. So the definition of an investigation is a positive student or staff member that results in a quarantine of other students and staff members. So we have 20 schools that currently have that situation.
So when that's said, it might not be that person, but it might be somebody in their family it's been recommended that
it has to be a student or staff person to be a school investigation.
Okay.
So we have students who are quarantined because of a family member or household contact, or because they were a close contact in some other setting. That's not considered an investigation. It's only if the positive results, the positive is a student or teacher, staff person, that results in quarantines related to school.
Okay.
Yeah.
Thank you.
And we have some situations where we've quarantined 5 kids, and we had a situation yesterday or the day before, I think it was 85, is that right? 85 for one positive. So it varies quite a bit and has significant implications. I know, for example, in Germantown, we had a staff person, but they resulted in the entire 8th grade getting shut down. So, and going virtual.
Okay. Thank you.
Yeah. So in Ozaki County, we have 1,194 positive cases currently total since March. And in Washington County, we have 2,141. Yeah. And 56 outbreaks in Ozaki and 61 in Washington County. We've had 19 deaths in Ozaki and 31 in Washington County. But our numbers, 25% of those numbers are from the last month. So it's spreading quickly.
How many deaths in Ozaki?
19.
Kirsten, how's the hospitalization? Like, I've been kind of following the trend, and it seems to be pretty level in at least Washington County. It's kind of bounced between 5.7 to, I think the latest is 5.39. We're not seeing an uptick in hospitalizations in relation to the infections we have, but we haven't the infections at the long-term care facilities are relatively new.
Right.
So that's where we're really gonna, if we're gonna get any hospitalization, that's where it's really gonna come from.
Well, and I think what we're going to see, and this is again me and my crystal ball, but I think what we're going to see is that these increased numbers currently are in young people, so school-age children, 20 to 30-year-olds. They will likely infect their family members, parents, grandparents, and that's when we're going to see the hospitalizations go up. But it's probably going to take a month or two for that to really play out. Right now, we're just seeing an increase in numbers in those younger populations, but there will be implications for their families and grandparents, et cetera. So I think that's where we're going to see the hospitalizations come in. So it's probably November-ish is when we'll see those numbers increase.
Hopefully I've been following on the vaccination or the vaccine, how it's progressing. And the last I had read that actually US had purchased quite a few of them already in anticipation that they'll be approved from a number of manufacturers. So that's one thing that's pretty positive, I think.
So around the vaccination, obviously we have a number that I think there's 4 that are in the phase 3 clinical trial. I can't imagine that any of those will be readily available for the public until late spring. The United States, many countries have purchased masks and have paid for them to be produced rapidly, mass production. But by the time the phase 3 clinical trial is over and it's readily available for the population, so outside of those high-risk vulnerable populations, I don't think it will be readily available until next spring. So Dr. Redfield, who's the director of the CDC, testified in Congress yesterday or the day before. And that's what he said as well. I think he's right. I think that's where we are. We may have one that's been given emergency use authorization sometime this early winter, but that emergency use authorization will be applied to the most vulnerable and highest risk, so potentially physicians, those working in healthcare settings, maybe in long-term care settings, but in terms of being readily available for the public, I think it's going to be late spring.
Yeah,
the best case.
Yeah, that's what my concern is getting it to those people that are vulnerable. If it does come and it is approved, get those people that are at the at-risk patients, so that that's where we really got to hit the general population. That I think that we find down the line, as long as we get those people that are the most vulnerable and get them protected. Chris, you're muted. You got to unmute yourself. Chris Dice, hit your unmute button. Or do I do that?
There
you
you
go.
can hear me.
There you are.
Okay.
Okay, now we can hear you.
As far as the deaths go, what's the age group that have died? Is there one age group that's more than others, or?
I think we've only had maybe two people in their 50s. Everyone else has been over the age of 60.
Okay.
Yeah.
All right. Thank you.
Sure.
Yeah, I had read that about 92% are age 55 or older.
Yeah.
Well, I don't really like that statistic. I'm in that group.
I'm 65, so I'm right with you, kiddo.
I think one of the things, though, it's not that anyone is easy about this or says, oh, I think our young people are thinking, well, I can get it and there's not going to be an issue. But I think one of the scariest things about it is the long-term effects that we're finding, especially in our youth, that revolve around cardiac problems, fatigue, brain fog. I'm going to be honest, a few months ago, I was like, well, I'm above 60, but I feel like I'm a very healthy adult. And I was like, well, if I get it, I should be fine. But I think as we move forward with this very scary virus, that there is a lot of side effects and a lot of really bad things that are happening to young people that get it. They might not die and they might not even be hospitalized, but they're getting really sick. So I just, not to put a gray cloud over this, but I don't, and not that any of you are doing this, but I think it's very important that people understand that it matters how old you are, but it also is finding some really serious effects from young people that are healthy and getting it.
Well, I appreciate those comments. Thank you.
Yeah.
Yeah. Any other questions around our response? We've been really trying hard to work closely with our school districts to help them with their contact tracing and education, and it's been challenging. I think for us, the biggest challenge we're experiencing right now is people are just being dishonest. They don't want their children to be quarantined from school. They don't want to have to miss work. But in doing that, they're really jeopardizing the ability to have school in person and other people's health. And it's been difficult for us in the health department to handle this. So, and people are being just blatantly dishonest.
Or angry.
And
Okay.
angry, but it's also the dishonesty, I think, is probably the most demoralizing piece, that it's really frustrating. And you don't want to argue with people, and you understand that it's hard, but yeah, we have a lot of angry people calling us parents, and the school districts are dealing with it first. So they,
You said-
Oh, excuse
Sure.
me. How is the contract tracing going? Do you feel you have enough help? Do you have enough funding?
so we have funding through December 31st. I'm fearful about what it's going to look like after December 31st. And the state's not been forthcoming about how much funding we're going to have. We do currently have 2 permanent positions that are open. We've had 2 people who resigned in the last 2 weeks. And we are hiring an additional 6. So we're hiring 5 more contact tracers. We're going to fill those 2 positions. We're hiring a contact tracing coordinator and then a testing coordinator. And we'd like to get them all hired by the end of next week because we just need more help. Yeah.
Thank you.
Kirsten, have we figured out a way to get the word out to the public on how important it is to work with our health department and to be honest and to make certain that if kids are sick, they shouldn't be going to school. I mean, we talked about it, you, I, and Josh a little while ago, but have we figured out a way or an avenue to get that word out?
No, we've been toying around with the press release and then doing some press, sort of putting out the press release. When we do that, we usually get all the news stations calling us. I think the message really, we've been very nice and we want to work with you. I think we're past that. We toyed with the idea of actually issuing isolation orders and sending a letter to people's houses. Something that happened, and is continuing to happen, but happened on the very first day of school, which I never in my wildest dreams imagined would happen, is people sent their known positive kids to school. The only reason we caught it was because that one child in particular was so ill by second period, they went to the nurse's office and the nurse had the list of the positive kids. And she said, well, you're not supposed to be here. And from that, we then sent out a recommendation to all the schools because that resulted in a number of kids being quarantined. That child was symptomatic. We sent notification to all the schools saying you need to flag in your attendance software all the kids who are quarantined and all the kids who are positive who shouldn't be there for the dates of their quarantine and isolation, because we don't want them showing up and sitting through class. We would have never figured out that that child was there if she hadn't presented herself to the nurse's office because she didn't feel well. So that's what we've done moving forward. But since then, it's happened more. I think it's happened twice more. Obviously not the same child, but in other school districts. So I never imagined people would actually send kids who are known positives. And we've realized too in our contact tracing that parents are asking us, what are you going to share with the school? What are you going to tell them? Because they're trying to see how much communication we have with them, which is also being gamed on the quarantine side. So, trying to change dates so their quarantine dates are shorter so they can go back to school. And we've ended up landing on whatever we're told in the positive interview date. So if a positive case tells us, these are my close contacts and these are the dates I was exposed to them, that's what we're sticking to. We're not changing it. We're not negotiating. We think that's probably the most truthful answer, because once the implications of this quarantine are put in place, people are scrambling to change their stories. And we think the best course of action is to trust that first interview. And maybe that first interviewer could potentially have made a mistake, but we can't trust what anyone's telling us. So it's been challenging.
That's sad. That's just too bad.
Yep.
You know, Kirsten, when a child is sick at school, and let's just say that, because this happened all the time, they were fine, the mother sends them to school, and they get to school, and by noon, they're feeling sick. Are they taking everybody's temperature at school that come in? I mean, I would assume they are, but is there any type of protocol that the health department says this has to be done?
So we've landed that the parents have to do a screen before kids get to school. The challenge with temperature taking is it's not everyone has a temperature.
Right.
So only 30% of positive cases have a temperature. What's also happening, again, never in my wildest dreams imagined this would happen, is kids become symptomatic and parents are now refusing to test them because they don't want to have to quarantine the siblings. So instead of testing them, they just say, I'm just going to, because the guidance from the schools is if your child is symptomatic and you don't test them, they have to stay out for 10 days. So the parents saying, I'll just accept the 10 days for child A, so B and C can go to school, and I'm not going to test any of them. But again, we're really risking the spread in schools because it's highly likely those siblings are going to become symptomatic and become positive at some point because they're close contacts and they live in the same household. And there's nothing from our perspective, if someone's not tested, we don't have any standing to say you have to quarantine the close contacts. So my worst fear is that we're just going to see rampant spread in schools and that the end result is schools are going to have to close down. And the way people are behaving now that's exactly what's going to happen. And I think if we do some messaging, that's what it's going to say. It's no more like, please work with our contact tracers. It's, look, your behavior, your dishonesty is going to result in your children's schools being shut down. You need to be honest. You need to protect the rest of your community. The end. Yeah.
I agree with you.
Yeah.
Yeah, it's obviously if people aren't complying voluntarily,
Right.
we have to take further action. So, and when you have parents lying to contact tracers, refusing to have their kids tested, that's just beyond the pale. That becomes very problematic for the health department to manage this whole situation. Right. The hammer may have to be dropped.
Right. I imagine we'd have pushback on quarantine, but again, I never in my wildest dreams did I think positive kids would be sent to school, known positives. Yeah.
So how will this message be delivered?
I think what we've talked about internally, and I still need to connect with Josh and Jason, but that we'll do some sort of press release, very straightforward, and it will likely result in our media requests. That's usually how it happens, but.
Would it be possible to design or make some type of a pamphlet that could be shared with schools that schools could distribute?
So we have given schools, and if you go to our website, that we have an entire page just for school resources. We've given them every resource under the sun. I think they're in the same place we are. A pamphlet, they know, they've communicated, they've made it look pretty, they've emailed, they've alert texted. They've done everything they can to communicate in a friendly and easy manner. People are just blatantly disregarding it.
Okay.
Yeah. So it's good times here in the health department.
Yeah.
I feel for you. I can't imagine how difficult it is for you guys to work within this situation. So I appreciate all that you do, and very thankful that we have such a great director and awesome employees. So
yeah, they are amazing. They've been phenomenal.
Oh, remember, it flows down to the top too, so you got a good director, so don't sell yourself short.
Thanks, Don.
Is there any other questions on the COVID update or any? Okay, seeing none, 2020 budget amendments, COVID funds and beach contract.
So these are just in here. Normal process is we give these to you just to review. This is dollars that we're getting from the federal government. This is the CARES Act dollars. And then the second is our beach grant that we never exactly know how much we're going to get. So we don't include it in the budget until we actually get the dollars. So these are.
When does that happen? When do you actually get the dollars?
We usually get them, so that our beach work starts at the end of May. Generally speaking, we get them in July-ish. Yeah, so.
Okay.
Yeah. And then the 1.25 or almost 26 million is CARES dollars specifically for COVID. I'm not, how much of it have we spent so far?
700?
We've spent about 700,000 of it so far.
Okay.
And it's primarily on staff time. So overtime and hiring, we've hired roughly 40 contact tracers. Like I said, we're hiring some more people in the next week and a half, and they all are paid out of this money.
Okay, thank you.
We need a motion and vote on this, Kirsten?
I don't think so. Just the fact that you know that you're aware of it and it's going to the Health and Human Services Committee and Ozaki County to be part of our budget. I don't think it needs a formal motion. I just wanted you to know that that's what we have. And that's what we're spending it on.
Okay, good. Any other questions or discussion on the amendments? Okay, we'll move right into the 2021 budget.
So our budget request this year, I want to preface this by saying this is what we've asked for. We've done some reorganizing starting January 1st, primarily. This is something I've been wanting to do for a while, but I think through our response, our pandemic response, we realized that the value and the ability of many of our staff members to be agile and able to pivot in an emergency, and that there's value in having better integration between our clinical work and our strategist work. So we've tried to integrate those two sort of what I would formerly have called silos so that they're more closely connected. So instead of a nursing silo, really a nursing piece, it's gonna be community health. And then our health strategist will still be health strategist, but there'll be better integration. We'll have a data person that sort of crosses over between the two. You can see the org chart is in your packet. So the pandemic sort of helped with this transition, but then the other piece is the actual numbers that you're seeing reflected here are likely going to be inaccurate, because we know we're going to be getting more money for the coronavirus response, which will which will in effect reduce the money that we spend from levy, because it'll be supplemented by response dollars. Because again, everyone in our department currently, literally every single person has some role in the coronavirus response. And I would imagine that will continue through next year. But this is what we're proposing. You can see the org chart. And then under the public health expansion requests are really what we've changed. So I upgraded all of my leadership staff to the same level, and the expectation is they all have a master's degree, which they all currently do. Some of them have not been paid adequately. So I've upped them all to the same level as leaders. You can see that in the WIC director, the health strategy director, and the community health director, and the business manager. And then we have a nurse vacancy right now that I'm requesting we fill with a social worker. So again, that's part of the better integration between our clinical services and our health strategist work. So that person will work closely with our maternal child health team and work closely with WIC, because a lot of the pieces that we're providing are really social work, so sort of that case management, making sure they're having access to the resources they need. And we're trying to really build a deeper and broader expertise for the whole department, but in adding some more professions, I think we can do that in a better way. And then you can see we have some health strategist positions. We're increasing a current communicable disease nurse. She does immunization and communicable disease to full-time. That we've seen during the pandemic. We need people who are full-time and not part-time. And then the explanation for the community health director and the health strategy director in here as well. Yeah. Any questions?
I have a question, probably not related to that a little bit. Are we still going out to the restaurants and stuff when I see?
Yes, we are. That's a great question, Doreen. So actually, and I can't say how much I'm thankful for our environmental health team. So early on in the pandemic, they willingly got trained to be contact tracers. They were our key contact tracing team, and they were great at it. And it's interesting. They're really good at dealing with the public. Never in my wildest imagination did I think I would have to ask them to pivot to being contact tracers for a pandemic, for a disease. But because of the skills they've established working with restaurant owners, they're really great at doing contact tracing. So they were doing contact tracing early on for us for the first month or two, and then they went back to doing environmental health. We pushed them to do as many inspections as they could as quickly as possible, knowing that we were going to see a surge in the fall, and we were going to need them back as contact tracers. So as of probably a month ago, they're all back. They're not doing restaurant inspections. They have one of them who's doing restaurant inspections related to new licenses or if there's a fire or some sort of emergency. But the rest of them are doing full-time contact tracing and have been asked that if they have downtime or 1 or 2 days a week that they can schedule inspections, they do that, but the rest of the time is contact tracing. So we are trying to make sure that we keep up with making sure all the licenses all the inspections are done, but we're a little bit behind compared to last year just because of the current situation. But actually, for the most part, they've done a great job. That's another interesting piece is we anticipated that we would have fewer license renewals with restaurants and bars, and that has not been the case. So we've had, what's the percent?
I don't even know.
I mean, very high. I mean, probably over 90% of people have renewed their licenses, which we did not. We really thought that this was going to have an impact on them. And it seems like most of our businesses have been able to provide some of their, take out other types of services and been able to hold their own, which is makes us really happy that our community has been resilient in that way. Yeah.
It's good to hear.
That's awesome.
Kristen, I have a question. When they go in and do inspections, and I know because we have no real laws here in Wisconsin regarding this, but do they do any like COVID recommendations to restaurants? Are we not allowed to do that?
We're not allowed to do it.
Okay.
So we reached out to DADCAP early on and said, if there's egregious violations, is there something we can do with their license? Is there some sort of contingency? And the answer was no. So we have to stick very closely to the guidance by DADCAP, specifically for restaurant inspections only.
Okay.
We have been providing some education while out in the field because restaurant owners have questions, but otherwise that's it.
Have you presented the budget to Ozark County yet?
No, you are
Okay.
getting it first. Washington, Ozark County, we had an internal meeting. The executive teams and the budget teams met to go over it. Everyone agreed that it was good to move forward, but it has not gone formally to either board.
Okay,
Yep.
all right, thanks.
Chris, I think it's going to be on your agenda next Tuesday,
Yeah,
actually. Yep,
Oh.
next Tuesday or the
okay.
following
Oh, for
Tuesday.
Human Services Department?
Human Services. Mhm.
Okay, yeah.
Yep.
Are we gonna need a motion and to approve this, to move it to? Okay.
Yes, please.
All right, entertain a motion to approve the budget as presented and amended
For 2021.
for 2021.
Yeah, I'll make that motion.
Okay, we have a second.
I'll second it.
Okay, thank you. Okay, either, okay. Any further discussion on it? Hearing none, all in favor, signify by saying aye. Aye. Any opposed? Okay, passes to go to next Human Services, and where, does it go directly to the board at Ozaukee County, or do they have,
No, we'll go to both human service committees.
okay, good. Okay, next, last on the agenda is next meeting date.
And that is a good question because I didn't write it down and I don't know when it is, but it will be forthcoming.
Okay,
I barely know what I'm doing the rest of the day versus
Well, I
2 months
do it.
from
November
now.
20th.
What is it?
November 20th.
November 20th.
November 20th, okay.
November 20th.
And another Zoom?
Another Zoom. I think this works well.
Yeah, it actually does produce
Yeah.
them, so.
Yeah.
So, okay, any further business, any other comments or anything? Just keep on trucking, Kirsten, tell your
Thanks.
people we're supportive, and, you're always, I guess you never appreciate your health department until you need them, and like, we need you guys big time, so thank you very
Thank you.
much.
Yeah,
And thank you all for your
hard work.
support.
Okay, hearing no more business, thanks everyone for coming, we're hereby adjourned,
Oh.
thank you.
Oh, I do have one more question. I'm
oh,
sorry. Just before
sorry.
we go. I understand that the masks wearing is the recommendations for mask wearing. Is it true that that's ending also in the near future?
So the mask,
Okay.
the governor's mask order ends on September 28th, I think it is, at noon. The health department's going to come out with a statement on our website that just says that we recommend mask wearing, and that we recommend school districts require masks within their school, within their buildings. Because that's been a big question for the school districts. We are in a little bit of a difficult position around making an order. I'm pretty sure if I were to order masks, a mask requirement similar to what the governor did, it would be struck down immediately. And I don't think that's a win for any of us. We want people to wear masks. We don't want to make it controversial. Overwhelmingly, I think people are complying. I see more people in masks than out of masks, which is reassuring. But I think the schools are really concerned about how to enforce it. So I think what's going to end up happening is they're going to have pass their own policies at the school district level. But we are going to recommend a mask requirement in schools, absolutely. And then just a blanket statement that we recommend masks.
Okay. And
Yeah.
do you think then, Toby, come September 28th, do you think that will be struck down if Tony Evers says we got to continue this mask wearing?
So it's unclear. I asked that question yesterday on a state call. It's unclear if they're going to extend the mask order. It's unclear if there's been an if rulemaking's been initiated around it. I'm not sure what's happening. Don, you might know more than I do right at this point, but
Yeah, he's probably going to extend it from what I understand, what I've read. I do not believe the legislature will challenge it. It's a 70-30.
There's actually there's 3 lawsuits now. There's a preemptive lawsuit. I don't think the governor's going to extend it. There's a suit that was filed yesterday for a declaratory judgment saying that he cannot do it, which is in, I think, a circuit court. So I would not anticipate the governor using an order. I would anticipate the governor doing something like an order, but not a public health emergency.
Okay, you don't expect him to extend the health emergency then?
Remember, you've got to extend the public health emergency first. And so it would be a third public health emergency. And then with the suits that are currently pending, I see them going down a path of wear masks that is not a public health emergency.
Yeah. Well, like Kirsten said, better than 70% of the people are okay with the mask. So even if there is an extension of it, I don't believe the legislature will step in. You know, the lawsuits notwithstanding. I just don't think it becomes a political issue because whether or not the legislature would come out and try to, even if it's unlawful, it just not, the public opinion would not be in their best interest to do it. So, but anyhow, that's all I know. Ethan, you're more in tune with things than
You are correct. The legislature is unlikely to, before November 4th, strike down public health order, a public health emergency. Remember, the mask order is a two-step.
Right.
The mask order he currently did was first a public health emergency, which by law he only has for 60 days. The reason his argument on the second one was that there was a surge in cases. So it was a new health emergency because of the number of cases we were having. And it was, 90 days removed from the first health emergency. Did the public health emergency, and then he did the mask order. To do that again under now 3 lawsuits, I don't see them doing that. I do see them maybe doing an emergency rule, maybe doing some type of other way of getting at masks.
Mm-hmm.
But you sounds correct. If this comes down, it would be a court decision. And as we saw with Safer at Home, and to Kirsten's point, when it was a court decision, people stopped. And so it's very risky to have a court declare it unlawful because then people take masks off.
Yeah. Agreed. Did that answer your question, Kathy?
I guess, I guess I'm still a little confused about it. I'm sorry. Our numbers are still going up. They're not dropping. I mean, our numbers are still going up. So doesn't that warrant extending the health emergency?
Sure,
It
but that's the
does.
legislature's job.
But I think the question is the legality of it. It absolutely does. The question is, do we have the authority and is it legal?
Right.
Yeah.
Well, right now, and please correct me if I'm wrong, it's really pretty voluntary now, isn't it? Up to individual.
I mean, theoretically, it's the law right now,
Oh,
but it's being enforced differently in different jurisdictions. The enforcement piece is local.
okay, so it's a law, but it doesn't matter if your jurisdiction doesn't want to follow it?
I mean, theoretically, they're supposed to follow it, but law enforcement has to enforce it. And so different jurisdictions have approached this differently. We've approached it as it's education. If it comes to our attention that an organization or a business is not handling it appropriately, we will reach out and just gentle reminder to places in Milwaukee or Dane County where they are issuing tickets. So, I mean, it's a variance of how it's enforced.
Thank you.
Yep.
Because I have a friend that was out in Wauwatosa at a very famous restaurant that had a sign when she walked in that said, because of the 4th Amendment, we do not require masks in this institution. And no one in there as a staff as any workers were wearing masks.
Yeah. So it's enforcement is at the local level.
Okay.
Yep.
This is politics, Kathy. It's politics.
I know. Have you heard the saying, wearing a mask isn't political, but it is a reflection of your IQ? Sorry, had to throw that in there.
Okay.
Well, that's why we live in a free country where everyone has an opinion and they can voice it as they wish.
Despite their IQ.
That's true.
I'll shut up at that.
Okay. Is there any other discussion or any other questions?
Mm.
Okay, hearing none, we're hereby adjourned. Thanks everyone for coming. Have a good day.
Thank you.
Bye.
Stay
Bye.
safe, everyone.